Assalamualaikum to Dr. Johari. Uh, Today I would like to present my clinical support care for rehabilitation geriatric and palliative patient in anesthesia at Sarawak General Hospital. All right, for the introductions. So when we talk about healthcare for elderly patient or those in palliative care, it's not just about treating their physical condition. The mental and emotional well-being matter as much. Imagine an elderly patient recovering from surgery. If they are in pain but also anxious or depressed, the recovery could be slower. That's why both physical treatment and psychological support need to go hand in hand. Now, anesthesia technologies play a crucial role in this. Together, they with anesthesiologists are the one who keep patients stable during surgeries or medical procedure by managing anesthesia and monitoring vital signs. Without them, things could get risky, especially for older patients whose bodies doesn't handle stress very well. And here the bigger pictures. Malaysia population is aging, which means more people will need specialized healthcare. But the challenge is we don't have unlimited resources, and managing elderly patients properly require doctors, nurses, physiotherapists, psychologists, and many others to work together. Without a good team, patient might not get the best care they deserve. So it's all about finding a way to integrate different aspect of healthcare, including physical, mental, and logistical, to handle this growing demand effectively. All right, next slide. Importance of physiological treatment. So basically, the goal is to keep body balance, manage pain, and make sure everything is working as well as possible. These include things like making sure the body has enough fluid, providing oxygen when needed, controlling pain, and helping patient recover through rehab. But it's not just about the physical side. Mental health is closely tied to how well the body is treated. If someone in constant pain and not just managed properly, it can seriously affect their mood, leading to depression, anxiety, and even making them withdraw from social interaction. Challenges in geriatric and palliative care. All right, the problem right now is that there are not enough specialists who focus on geriatric and palliative care. This means elderly patients and those with serious condition don't always get specialized attention they need. Doctors and nurses do their best, but without enough expert in this particular field, some aspect of care might be overlooked. Another issue is that the healthcare services are pretty fragmented. Different departments and specialists don't always communicate very well. So a patient might get a great treatment in one place but struggle to get follow-up somewhere else. It's like each part of the system is working separately instead of as a team. Then there is a lack of home-based care and rehab services. A lot of patients, especially the elderly, need ongoing care after leaving the hospital, but there's just not enough resources to support them at home. Without a proper rehabilitation, many struggle to recover fully, which affect their quality of life. To fix all this, we need better collaboration. Healthcare professionals, doctors, nurses, physiotherapists, and social workers need to work together with community services to create a smoother, more supportive system. That's where patients get continuous care instead of being left to manage on their own once they leave the hospital. Clinical experience during my clinical practice, I really noticed how important both physical and mental well-being are in geriatric and palliative care. It's not just about treating the illness. Patients need emotional and psychological support too, especially when they are dealing with serious end-of-life condition. Geriatric and palliative care services are actually spread across different hospital departments, which sound great in theory, but in reality, it's create a lot of coordination issues. Sometimes doctors, nurses, and specialists are not on the same page, which can make patients feel disconnected. One thing that really make a difference though is a proper anesthesia support, especially for elderly patients undergoing surgery. Seeing older patients are more vulnerable to complication, making sure anesthesia is well managed can really improve their recovery and overall outcome. For the psychological treatment in anesthesia, the body, okay, the body work best when everything is in balance. Circulation, breathing, and metabolism all need to be running smoothly. When something throw that off, we need to step in and help get things back to normal. There are a few ways we can do this. For example, IV therapy help keep fluid and electrolyte in check, especially if a patient is dehydrated or losing fluid. Oxygen supplementation, for example, is super important for people who have trouble breathing, making sure their body get enough oxygen to function properly. Pain management is another big one. It's not just about medication. Things like nerve block or even non-pharmacological approaches like physiotherapy or relaxation technique can really help. On top of that, rehab therapy and proper nutrition play a huge role in recovery, helping patients regain strength and heal faster. All of this especially important for patients recovering from surgery or dealing with long-term illnesses. Without this intervention, recovery can be slower and complication can become a bigger problem. All right. For a case study, I come across this case of a 68 years old patient who had to undergo a right above knee amputation. What made it even more heartbreaking was that he had been living alone for 20 years, completely isolated from his family. He had no support system and he was estranged from his children. So he pretty much went through everything on his own. After the surgery, things got very worse. He developed a pulmonary embolism, which is a serious complication where blood clot blocked an artery in the lung. Unfortunately, he didn't make it. He didn't make it. He passed away alone. This case really shows why holistic care is so important in palliative setting. It's not just about treating the physical condition. Patient need emotional, psychological, and social support too. If he had a stronger support system or better geriatric or palliative care, maybe things could have been different. And then it's crazy to think how much physical health affect mental well-being. When someone dealing with pain, stuck in bed, or fighting a chronic illness, it's not just about the body that suffers. It takes a very huge toll on their mind too. Stress, anxiety, and even depression can kick in, making recovery even more harder. The good news is studies have shown that proper rehabilitation program don't just help people regain strength. They actually improve cognitive function and mental health too. When patients stay active and engaged in their recovery, they feel more in control and less overwhelmed. That's why a team approach is so important. When doctors, physiotherapists, psychologists, or other specialists working together, they're not just treating the illness, they're supporting the whole person, both physically and emotionally. It's make a huge difference in the long run. Malaysian healthcare system is set up in 3 levels, each handling different type of care. First, the primary care, which is basically our neighborhood clinic and general practitioner. This is where people go for early screening, checkup, and things like for prevention, which is super important for elderly patient. Then we have a secondary care. which include district hospital, rehab services, and home-based program. This level focus more on recovery and ongoing treatment for patients who need extra care, but not necessarily need to go to the general hospital. Finally, the tertiary level, which is where the specialists come in. Major hospitals have been expert team handling complex cases, advanced treatment, and palliative care for patients with serious or terminal illness. The big challenge, though, is the growing financial burden of elderly care. As Malaysia population ages, care costs keep rising, and the system is struggling to keep up. The real need for better geriatric and palliative care services, not just in hospital, but also in community. Okay, so that older patient can get support they need without overwhelming the system from the community. The role of anesthesia and geriatric and palliative care. Anesthesia play a huge role in geriatric and palliative care, especially when dealing with elderly patients who need surgery or pain management. It's not just about putting someone to sleep for operation though, which is it is our job actually. But the whole point is the process is start from before surgery, pre-operative, continues during the procedure, intraoperative, and extend into the recovery post-operative. Older patients are often more fragile, so anesthesia technique have to be adjusted to make sure they are safe. Things like lower drug doses, careful monitoring, and specialized pain management are the key to avoiding complication. Since many elderly patients have multiple health issues such as cardiac disease, hypertension, or diabetes, anesthesia team have to be extra cautious to prevent things from going wrong. But it's not just about surviving surgery. It is about improving quality of life. Good anesthesia and pain management can make a huge difference in helping patient recovery smoothly. Stay comfortable, okay? And then the patient can maintain as much independent as possible. So as summary, basically, if we want a better care for elderly and palliative patients, a few key things need to be happen. First, healthcare provider needs to work together more closely. Right now, care can feel disconnected, so better collaboration between doctors, nurses, physiotherapists, and social workers would make a huge difference. I'm sorry. We also need more training in geriatric and palliative care. Not all healthcare professionals are well equipped to handle the unique needs of elderly patients, so proper education and specialization are crucial. Another big issue is accessibility, such as home-based and hospice care services need to be easier for patients and families to access. And many people actually prefer to receive care at home, but the current system doesn't always support that well. On top of that, pushing for policy that promote integrated care model is essential. When different parts of a care system work smoothly together, patients get better, more continuous care, right? Most importantly, we need to take a holistic approach, not just focusing on treating diseases, but also addressing mental health and emotional support and overall well-being. Elderly and palliative patients deserve compassionate, well-rounded care, and not just about medical treatment. With that, thank you.